Welcome to the webinar on the Toolkit for Engaging Patients to Improve Diagnostic Safety. In 2019, the Agency for Healthcare Research and Quality sponsored the development of a toolkit to improve diagnostic safety by engaging patients and family members. The toolkit contains two strategies: Be the Expert on You and 60 Seconds to Improve Diagnostic Safety. This webinar provides an overview of the toolkit and the strategies. The objectives of this webinar are to review the threats of diagnostic error to patient safety, describe the toolkit and how it can improve diagnostic safety, provide strategies for implementing the toolkit in practice settings. First, a little background. The MedStar Health Institute for Quality and Safety led development of the toolkit under a contract funded by the Agency for Healthcare Research and Quality, referred to as AHRQ. The goal of the project was to develop, implement, pilot test, and promote a resource to engage patients and families in the diagnostic process to reduce diagnostic errors. It's important to note that the toolkit was co-developed by patients, providers, researchers, and contract officers at AHRQ, so it brings to bear the worlds of practice and research, along with patient experience. Development partners also included the Baylor College of Medicine, Clinical Directors Network, and the National Nurse-Led Care Consortium. Diagnostic error is the leading patient safety challenge in the United States and is defined as the failure to A. Establish an accurate and timely explanation of the patient's health problems, or B. Communicate that explanation to the patient. Nearly every patient will experience a diagnostic error in their lifetime, and 57% of all diagnostic failures happen in ambulatory care. In primary care settings, 79% of the errors in diagnosis happen within the patient-clinician encounter, and up to 56% of these are related to miscommunication during the patient-clinician encounter. Thus, resources to improve communication within the patient-provider encounter are needed to improve diagnostic accuracy. At the start of the project, an environmental scan was conducted that identified several things patients and providers can do to improve diagnostic safety. For patients, one of the key strategies recommended by both patients and providers is for patients to tell their illness story or history fully and completely. Providers often report that patients withhold information initially that could have helped them make a diagnosis faster or may have resulted in a different diagnosis. Some patients report that they do not feel heard by their providers, which can lead to a breakdown of information sharing during the clinical encounter. So it's important for patients to tell their full story and feel comfortable doing so. Other strategies that have been recommended for patients to help them partner in diagnosis include conveying their symptoms, concerns, and history in a clear and concise way, asking questions when they don't understand, and using checklists or other structured communication tools to help them remember the information they want to convey or ask about. In addition, there are things providers can do to help improve diagnosis, specifically related to engaging patients and their families. For example, deep and reflective listening is central to clear communication within the encounter. Setting a visit agenda in collaboration with the patient has been shown to improve communication, particularly when that agenda allows patients to share what's most concerning to them. And being prepared for the patient visit by checking any pre-labs and reviewing the patient's clinical history before the encounter can also enhance diagnostic accuracy, especially when coupled with reflective listening. Based on environmental scan findings, our approach to the toolkit focused on paired tools, meaning if we gave an intervention focused on patients, we also provided clinicians and practice staff complementary tools to support the families and patient. With the Be the Expert on You strategy, patients are provided with a note sheet to help them tell their story in a clear, concise way. The note sheet can also serve as a prompt for patients so they don't forget important information. Coupled with this note sheet, the 60 Seconds to Improve Diagnostic Safety strategy aims to support providers in engaging in deep and reflective listening and fostering an environment for patients to share their story. By using the first minute of the encounter as the patient's minute, providers can allow patients to share their story, their illness history, uninterrupted. Together, these strategies support a collaborative dialogue and an accurate diagnosis. Let's first look at the toolkit's patient-facing strategy. The Be the Expert on You note sheet is an agenda-setting tool to help patients prepare for their visit. It allows patients and their families to become more fully engaged in their medical appointments by sharing important information that will assist in finding an accurate and timely diagnosis. The note sheet aims to solicit key information from patients, including why they are at the visit, what, if any, changes in their health they've had since their last visit, questions they may have about tests, treatments, medicines, or other health considerations, whether they've seen any other health providers, and a final question to help patients share what's really on their minds, what's concerning them about their health. When this note sheet was pilot tested, providers noted that the "What are you worried about?" question elicited important information from patients they might not have otherwise shared. It's important for all staff and providers to be familiar with the note sheet and be ready to help patients if they need it. Now let's look at the provider-facing strategy. Studies show that patients are interrupted by their providers in the first 11 to 18 seconds of telling their story. Deep and reflective listening is a component of mindful medical practice, grounded in the adage that the patient's story begins the diagnostic process. But even the best communicators and diagnosticians can fall short when they're faced with a huge patient panel and a busy schedule with competing administrative and clinical demands. The goal with the 60 seconds to improve diagnostic safety strategy is to provide deep and reflective listening for 1 minute at the start of the encounter. Allowing the patient to tell his or her story without interruption gives providers the opportunity for a diagnostic pause, a point in the encounter where providers can reflect on the information the patient is sharing, coupled with the information from the medical record and direct observation. In this way, providers can pick up on contextual cues that aid in establishing a working diagnosis or identifying when the patient's chronic health condition may have changed. With the 60 seconds to improve diagnostic safety strategy, providers first listen, then ask questions that deepen understanding and avoid jumping prematurely to advice or judgments. This approach helps prevent premature closure and anchoring biases that can lead to diagnostic errors. The next few slides are dedicated to reviewing practical materials that were developed as part of the toolkit for engaging patients to improve diagnostic safety that will assist practices in implementing the two strategies. The Toolkit Implementation Roadmap is available on the AHRQ website. This roadmap is the starting point for implementation and helps with planning. Early stakeholder engagement is critical to any successful implementation. The toolkit contains an infographic, which provides statistics about the incidence of diagnostic errors. The infographic can be useful to engage leadership and raise awareness of the problem. This webinar can also be used to orient key stakeholders to the toolkit and how it can be implemented. As part of the toolkit, 2 planning worksheets are available to help team members plan for implementation of the paired strategies. The Be the Expert on You planning worksheet and the 60 seconds to improve diagnostic safety planning worksheet. Each worksheet provides practical questions and guidance that can help local practice champions establish effective scope, workflow, adoption, and use of the strategies. The toolkit includes several helpful training materials to facilitate implementation. A 1-page handout for staff training can help staff become comfortable with introducing the Be the Expert on You note sheet to patients. A short slide presentation with speaker notes can help train providers on how to listen deeply for 60 seconds to cultivate presence, attentiveness, and curiosity during the patient encounter. Finally, the practice orientation and training slides can be adapted with site-specific implementation plans and used to orient and train everyone in the practice. Here are some helpful tips to consider as you begin using the toolkit for engaging patients to improve diagnostic safety within your organization. Tip 1. Focus the intervention on select patient populations. For example, choosing patients who are coming in for acute or episodic clinical visits or new problems may be a good place to start. Tip 2. It might be helpful to give the patients the note sheet after they finish all other pre-visit paperwork. This approach will help the note sheets stand out from other papers and allow patients to keep it with them during their encounter. Tip 3. Some patients may have difficulty completing the note sheet. When rooming patients either in person or online, it's a good practice to quickly scan the note sheets. If the page is blank, ask patients if they might want some help and take a minute to help them complete it. This step works well for patients with low literacy. Be sure to do this after the patient is in the encounter room. Tip 4. Providers may also use the Be the Expert on You note sheet to help prompt patients who may be slow to share or to redirect patients whose stories go too long. The note sheet can also be used to co-create a visit agenda, aiding the patient and the provider in organizing the visit and ensuring questions and concerns get addressed. What can you expect when implementing the toolkit for engaging patients to improve diagnostic safety? A reduced propensity for diagnostic errors, which is linked directly to improvements in clear, concise, correct, and complete information sharing from the patient. Improved relationships with patients, leading to improved patient experience and patient safety. An enhanced connection with patients and reduced technical burnout, and a return to the joy of healing. The toolkit also includes an evaluation planning tool and patient and provider surveys. These materials can help in evaluating the local impact of the strategies on patients, providers, and practices. Thank you for listening to this webinar on the Toolkit for Engaging Patients to Improve Diagnostic Safety. If you have any questions, please contact the project team listed on the AHRQ website.